my campaign is about bipolar disorder, specifically in women. I will touch on 3 main points. The first point is kind of just some statistics about women who suffer bipolar disease. Secondly, will be some signs and symptoms. And third will be how to help our fellow women, our friends, our mothers, our sisters, how to deal with this disease, and kind of how to identify it as well. So, bipolar disorder is not something that can be prevented. It's not something that can even be predicted most times. Like many other mental illnesses, it's an unseen force that carries an iron fist against the people who have it. The reason for this entire report is that I would just like to bring awareness to it, and just awareness to those women who are suffering, and to let them know that we see you and we know, and we're here to help. So like I said, my focus will be specifically on women, and so many women that we could ever know suffer with this silent and deadly disease, and it can be, unfortunately, sometimes too late to get the help that they need. So bipolar or manic depressive disorder, it's a frequent, severe, mostly recurrent mood disorder associated with great morbidity. The lifetime prevalence of bipolar disorder is 1 to 3 to 1 to 6%. The mortality rate of this disease is 2 to 3 times higher than that of the general population. About 10 to 20% of women with bipolar disorder take their own life, and 1/3 of women with the disease admit to at least one suicide attempt, Perio 2015. The clinical manifestations of the disease are exceptionally diverse. In women, they range from mild hypomania or mild depression to severe forms of mania or depression accompanied by profound psychosis. Bipolar disorder is equally prevalent across sexes apart from rapid cycling. Rapid cycling is a severe and difficult to treat variant of the disorder, which arises mostly in women. Women are twice as likely as men to experience rapid cycling, which means that they have 4 or more mood episodes per year, Perio 2015. This augmented intensity of instability and frequency of mood switching can be deeply distressing, complicate treatment that these women are trying to get, and is associated with higher suicide rates. Some evidence suggests that the rapidity of cycling may be due in part to the fact that women are more likely to be prescribed antidepressants due to their more prevalent and severe depressive symptoms. Unfortunately, women who experience rapid cycling are at a higher risk for treatment resistance, complicating the treatment process. Women are more likely than men to experience depressive episodes in the course of their illness, and depression tends to be the predominant feature of the illness. In fact, 75% of women with bipolar disorder present with depression at the onset of the illness compared to 67% of men. And this depression tends to be more intense and lasting longer. Perio 2015, Hayner 2016. This helps to explain why women are significantly more likely than men to be misdiagnosed with unipolar depression and subsequently treated with antidepressants. The high rate of misdiagnosis is alarming because it not only delays correct treatment, but because antidepressants are inappropriate for people with bipolar disorder due to inefficiency and the risk of triggering mood switching. Both the prevalence of depression and misdiagnosis may also partially explain why women with bipolar disorder are significantly more likely than men to attempt suicide, Hayner 2016. Bipolar disorder can be deeply disruptive and have a damaging impact on the functionality and quality of life for both men and especially women. However, researchers have found that women report significantly more disruption in social/leisure life, suggesting that there are meaningful experimental differences between men and women. These disruptions are important to address in treatment to help women with bipolar disorder fully heal and restore both functionality and overall quality of life. Furthermore, Women are more likely to be hospitalized than men as well, although that may be due to part the higher willingness to seek treatment. The behavior that I'm trying to change is the stigma that surrounds bipolar disorder, especially with women who have it. I think we have all encountered at least once in our lifetime the insult of, "You're just crazy." But the main question is, why is that an insult? Why is that an insult, especially against women? We should be comfortable with talking openly about mental health. Stigma causes people to feel ashamed for something that is out of their control. Worst of all, stigma prevents people from seeking help that they need, that they truly need. For a group of people who already carry such a heavy burden, stigma is an unacceptable addition to their pain. I hope that this report touches all hearts and minds of different individuals, regardless of race, age, or sex, but specifically young women. Being young and trying to figure out your life is hard enough, but being young while also dealing with a mental illness is even more difficult. These women need to know that they are not alone and someone sees their struggle and is advocating for them. As of now, the most effective way of managing bipolar disorder is lithium, whose mood stabilizing effects are believed to occur via distinct cellular signaling pathways targets such as glycogen synthase kinase 3 inhibition, and is FDA approved for the treatment of acute bipolar mania. MD Matthews 2012. In more recent years, researchers have gained more understanding about how the brain is wired and how that can play a role in the advancement of treatment options for bipolar disorder. Direct-to-brain treatments, such as transcranial magnetic stimulation, have become increasingly studied recently as potential standalone or adjunctive treatment for bipolar disorder. MD Matthews 2012. Now, finally, here are some ways to manage BP. Be in full and active participant in your own treatment, in your family's treatment, in your sisters, your mothers, whoever. Study up on the symptoms so that you can recognize them in yourself and research all your available treatment options. The more informed you are, the better prepared you'll be to deal with symptoms and make good choices for yourself. Using what you've learned about bipolar disorder, collaborate with your doctor or therapist in the treatment planning process. Don't be afraid to voice your opinions or questions. The most beneficial relationships between patient and healthcare provider work as a partnership. You may find it helpful to draw up a treatment contract outlining the goals you and your provider have agreed on. Don't expect immediate and total cure. Have patience with the treatment process. That is the biggest thing, is patience. It can take time to find the right program for you. Today, I have discussed bipolar disorder, the statistics for women who have it, some of the symptoms and ways to help yourself or even someone you know who has it. The main point of this report is to give hope to the people who need it the most, to let them know that they are not alone. Thank you so much.